Hi.
Hi.
I'm here to check in for my son's appointment.
Okay, what's your child's name?
Harrison Smith.
Okay, give me 1 second. Okay, you're just gonna have to fill out some paperwork and then the nurse will call you back and then you'll be set, okay?
Great, thank you.
You're welcome.
Concern for feet and legs. Lots of pain. Tantrums.
Excuse me? What's wrong with your baby's feet?
Harrison Smith.
Yes.
Hello, you can follow me. Hello, my name is Mia. I'm gonna be your nurse today.
Hi, nice to meet you.
Is this Harrison?
This is.
Okay, can you confirm his full name and date of birth?
Sure, it's Harrison Smith and his birthday is February 26th, 2025.
Okay, perfect. I'm gonna get some vital signs. I'm gonna unwrap him a little bit. Okay, and cover him up. Okay, perfect. And I'm gonna take a listen to him. Okay, perfect. All right, I'm just gonna ask you some questions and get a history from you, and then the doctor will be in.
Sure.
Good morning, Mrs. Baker. It's nice to meet you and little Harrison. I'm Dr. Hart. How are you guys doing today?
Oh, I'm okay. I'm really nervous. I've been reading a lot online and I'm just really hoping you can answer my questions and see what's wrong with my baby.
Yeah, of course. So we'll take everything step by step today. First, I'm gonna take a look at his feet. So I'm just gonna ask that, you hold
Okay,
him pretty
just be
still.
really careful. Yeah, of course.
Okay, let's see here. Okay, yep. Sure looks like it. Yep, came to the right place. So it looks like your baby has a condition called Talipes Equinovarus. It's also called clubfoot. You might have heard of that before. So it's a congenital condition where the feet are turned inward and downward, and that's what you see with your little baby there. It's actually more common than you think. It's seen in 1 to 1,000 births.
1 in 1,000 births?
Yes.
Oh my gosh, how could something like this happen? Like, did I do something wrong during pregnancy? Is he gonna grow up and look really weird and people are gonna make fun of him and then he's not gonna be normal?
No, you're okay. You're okay. I see that you're very anxious and it's really understandable to be feeling that way. It's not your fault, okay? We don't know exactly why it happens. It's typically a combination of genetic and environmental factors. Sometimes there's a family history, but really we don't know what the clear issue is. So it's not something you could have prevented.
Oh my gosh, I feel like I need to call my husband about this. I'm really anxious and this is just like, I feel like I did something wrong and just give me 1 second, let me call him.
Okay.
Hi, honey.
2 hours later.
Okay, yeah, well, just hold on, let me ask her. So my husband wants to know, what are the chances of, like, if I got pregnant again, what are the chances that this could happen?
So that's a great question. Okay.
Well, let me put him on speakerphone for you.
Okay.
Okay.
Hello, Mr. Smith. That's a really good question, and I completely understand your concern. The chance of this happening again, it is a little bit higher if there's a family condition, which would be your son here. Statistically, it's about like a 3% chance of any future children you wish to have, which is a relatively small chance. So
Okay,
I
thank
hope
you.
that answers your question.
Yeah, let me hold on. Okay, did you hear that? Okay.
2 hours later.
Yeah.
Okay, I'll call you back. I'll call you back after this appointment. Okay, anyway.
Oh, okay. You ready?
Mm-hmm.
All right. So now we can talk about treatment, okay? For most babies with this condition, the earlier we start the treatment, the better. So we start with a technique called the Ponseti method, and that involves gentle stretching and casting of the feet. Over time, we gradually correct the positioning.
Oh,
that
wow.
Inward and downward.
That really sounds like it's gonna hurt. How do you make sure that he's comfortable? I don't want him to be in a lot of pain.
He'll be fine. We do our best to ensure that he's as comfortable as possible. In the beginning, the treatments may cause some discomfort, but usually it's not painful. We'll guide you through everything in the process. Me and the nurses will be here to help you with any questions along the way. we're here for you. So if you need anything or have any concerns, that's what we're here for.
Great, thank you. I don't want him to be in any pain.
Yeah, he will be fine. So over the course of treatment, which can last several months to years, we'll monitor his progress. And in some cases, after the initial casting, your baby may need surgery or have to wear a special foot brace.
Surgery? What kind of surgery? Is this going to affect his growth and development later on? Is he not going to be okay?
That's a good question, Mrs. Smith. Surgery will be called a tenotomy, which is where the Achilles tendon is cut out to allow the foot to flex upwards. So with proper treatment, most children with club foot go on to have normal development. It doesn't affect the child's ability to run, walk, play. In fact, many kids grow up without any limitations at all. Key is early treatment, which is what we're trying to do here, and regular follow-up to ensure that the correction holds.
So you're saying that he'll be able to walk normally one day?
Yeah, absolutely. So the goal of our treatment is to ensure that he'll be able to walk, run, play, and grow up just like any normal child. With the right care, which is what we're here for and we're informing you about, his feet will be corrected and he should be able to grow up with no major issues related to this condition.
Wow, well, thank you so much. That really helps to ease my mind, and I'm just glad to know that we're starting early and that there's actually hope for him in the future.
Course. Yeah, you're welcome. So we're here to support you every step of the way, and your husband.
Well, thank you, doctor.
Hello. So I see Dr. Hart is doing the Ponseti method.
Mm-hmm.
So it is important that you will come back in every 1 to 2 weeks and they'll reevaluate the cast and they'll put a new one on. Your baby will be in the cast 24/7 until you come back and they change that for you.
Okay.
Okay. He may have to get braces or surgery in the future if the casting does not work, but we'll reevaluate that if the time comes.
Okay.
Okay, do you have any questions?
Yes, so what do I do about bathing? Like, can the cast get wet?
Yeah, you don't want to get the cast wet if possible, so I would use like plastic and I would tape it around the cast when he's in the bath.
Okay. And what about pain control?
So he really won't be in a lot of pain. He might have some minor discomfort. So you can try soothing him with like a pacifier, kangaroo care, just whatever you do normally when he's discomforted. Breastfeeding if you do that. But we will reevaluate if he needs surgery in the future and we can discuss that then.
Okay, thank you so much.
You're
This has just been a really stressful situation, so all of your reassurance has really been, making me feel a lot better, and it's helped me greatly. So
I'll
thank
give you this additional information if you have any more questions. But you can always call the office if you have any concerns. Don't hesitate to reach out and we'll discuss that then and we'll see you in 1 to 2 weeks. Okay?
Great, thank you.
You're welcome.